Azithrocin IV Infusion. Group name, Azithromycin. Produced by Beximco Pharmaceuticals Limited. Bangladesh. Indications. Azithromycin is indicated for infections caused by susceptible organisms in lower respiratory tract infections including bronchitis and pneumonia, in upper respiratory tract infections including sinusitis and pharyngitis, tonsillitis, in otitis media, and in skin and soft tissue infections. In sexually transmitted diseases in men and women, azithromycin is indicated in the treatment of non-gonococcal urethritis and cervicitis due to chlamydia trachomatis. Pharmacology. Azithromycin is an azalide antibiotic, subclass of the macrolide class of antibiotics. Azithromycin acts by binding to the 50s ribosomal subunit of susceptible organisms and thus interferes with microbial protein synthesis. Azithromycin demonstrated activity in vitro against a wide range of gram-positive and gram-negative bacteria including Staphylococcus aureus, Streptococcus pneumoniae, Streptococcus pyogenes, Group A, and other streptococcal species. Haemophilus influenza and parainfluenza, Moraxella tardalis, anaerobes including Bacteroides fragilis, Escherichia coli, Bordetella pertussis, Bordetella parapertussis, Borrelia burgdorferi, Haemophilus ducreyi, Neisseria gonorrhea and Chlamydia trachomatis. Azithromycin also demonstrates activity in vitro against Legionella pneumophila, Mycoplasma pneumoniae and Hominis, Campylobacter sp. Toxoplasma gondii and Treponema pallidum. Dosage and administration. Azithromycin can be taken with or without food. Oral or injection. Adults or elderly. For lower respiratory tract infections including bronchitis and pneumonia, upper respiratory tract infections including sinusitis and pharyngitis, tonsillitis, otitis media and skin and soft tissue infections. The total dose of azithromycin is 1.5 gm given as 500 mg once daily for 3 days. An alternative to this dosage schedule is at 500 mg once daily on day 1, followed by 250 mg once daily for next 4 days. For sexually transmitted diseases caused by chlamydia trachomatis, the dose of azithromycin is 1 gm given as a single dose. Alternatively, 500 mg once daily on day 1, followed by 250 mg once daily for next 2 days may also be given. Children. The dose of azithromycin in children over 6 months of age is 10 mg per kilogram body weight once daily for 3 days. Alternatively, 10 mg per kilogram on day 1, followed by 5 mg per kilogram for next 4 days is also recommended. There is no information on use of azithromycin on children under 6 months of age. For children, the dose of azithromycin suspension is as follows. 5 to 10 kilograms, 6 months to 2 years, 1.25 milliliters to 2.5 milliliters, 1/4 to 1/2 tsp, once daily for 3 days. 11 to 20 kilograms, 3 to 8 years, 5 milliliters, 1 teaspoon, once daily for 3 days. 21 to 30 kilograms, 9 to 12 years, 7.5 milliliters, 1½ teaspoons, once daily for 3 days. 31 to 40 kilograms, 13 to 15 years, 10 milliliters, 2 teaspoons, once daily for 3 days. 41 to 45 years, 16 to 17 years, 11.5 milliliters, 2.5 teaspoons, once daily for 3 days. Possible side effects. Azithromycin is well tolerated with a low incidence of side effects. The side effects include nausea, vomiting, abdominal discomfort, pain, cramps, flatulence, diarrhea, headache, dizziness, and skin rashes, and are reversible upon discontinuation of therapy. Pregnancy and lactation. Recent clinical studies have recommended that azithromycin should be considered for the initial treatment of chlamydial cervicitis in pregnancy. In other infections, azithromycin should be used only when clearly needed. It is not known whether azithromycin is excreted in breast milk. Exercise caution when administering to a nursing woman. Overdose effects. There is no data on overdosage with azithromycin. Typical symptoms of overdosage with macrolide antibiotics include hearing loss, severe nausea, vomiting and diarrhea. Gastric lavage and general supportive measures are indicated. Storage conditions. Azithromycin IV infusion. When diluted according to the instructions, azithromycin for injection is stable for 24 hours at or below room temperature 30 degrees Celsius, or for 7 days if stored under refrigeration 5 degrees Celsius.